American institutions have something in common. The institutions that are supposed to protect and champion the interests of children all hate Donald Trump more than they love kids. That single fact explains a lot of the decision making throughout this pandemic by the American Academy of Pediatrics, the CDC, and the teachers' unions. Allow me to explain. Now, of course, in America, in contrast with our European colleagues, we had massive school closures, but we didn't have all schools closed equally. Of course, private schools, schools that collect money, they ran in full force. And public schools weren't closed everywhere. They were closed, would you believe, not related to the number of people who had SARS-CoV-2 in the community. School closure wasn't related, of course, to the number of people in the hospital with SARS-CoV-2 or even the number of deaths. School closure and SARS-CoV-2 have no correlation, as far as I know, in any metric. In fact, the metrics that predict school closure are solely if a district is left-leaning, in which case it's more likely to be closed, and if a district has a strong teachers union, in which case it's far more likely to be closed. So the children who have been punished by school closure are predominantly children in Democratic stronghold cities who are poorer and often of minority status. And that is a consequence of the teachers' unions, who have largely opposed school reopening, even with a number of reasonable measures, and in contrast with our European colleagues who have reopened schools. Now, why? What accounts for the fact that the teachers' unions were so vehemently opposed to school reopening for so many months and working as we speak to, I believe, thwart school reopening and find a way to close us again? What explains this? And it's all explained by one quote. The moment Donald J. Trump said that he thought schools should reopen, many people decided that they shouldn't, merely because they dislike him. The same is true for the AAP. Now, Donald J. Trump, he notoriously put his thumb on the nose against masks. He didn't wear it, and he wasn't a good role model in that, and I don't condone that behavior. But merely because he's not a good role model doesn't mean you have to just do the opposite. But in the United States, we did do the opposite. We, the AAP and the CDC, recommended that even very young children between the ages of 2 and 4 wear cloth masks in daycare and in schools, wherever they may be. They should wear a cloth mask. This is in direct contrast with the World Health Organization, which felt that this was a ridiculous recommendation, that the harms of this are not outweighed by the benefits. And the truth is, no one knows, because there has not been any proper study of this topic. We don't know what is the reduction in SARS-CoV-2 spread from doing this versus not doing this. Our European colleagues think it's ridiculous to study because the upper bound of the benefit has got to be so low, it's outweighed by the harms. But we think it's ridiculous to study because it's got to work, it's a parachute. Well, that's a funny place to be in. But all of this originally was motivated because this is the opposite of what a man we dislike happened to say. And that's no good way to do policy. You see, thoughtful and reasonable people don't merely choose their positions to thwart someone they dislike, because people you dislike, who are often wrong and often heinous and say things that we strongly oppose, they sometimes might just be right. And I don't know about all his views, but I happen to know that on the issue of whether or not schools should open in SARS-CoV-2 times, the answer is yes, they ought to, because the net benefit of schools is tremendous. It affects both the health of the children, their upward mobility, and the stability of democracy itself. While the harms are actually rather small, numbers of studies show that there is no significant increase in SARS-CoV-2 spread in a community from opening school, and that schools can be opened with very little spread inside the school, even when there's massive community spread outside the school. Closing schools is the most catastrophic decision ever made in the United States in the last year. It's going to have repercussions 10 years from now, 20 years from now, 30 years from now, and will shake the very foundations of this country. And the people who contributed to it, they thought they were doing a good thing, but they didn't understand that in complex policy choices, you have to independently appraise the data, and you can't merely do the opposite of what people you dislike want to do. If someone you dislike suggests doing something smart, you should just do it. You shouldn't just do the opposite. So when it comes to masking young children, when it comes to school reopening, there is a commonality amongst all these institutions. They are not robust enough to triumph and transcend politics. They are dragged into politics. The people who participate in these panels, they cannot think clearly about evidence. They put their partisan preferences ahead of a sober appraisal of medical evidence. I don't blame them. It's natural to be drawn into tribes. But I would have hoped, I would have expected, I would have wished that academic-minded people, people who are thoughtful about evidence, would be able to triumph over these baser instincts, but we have not in the United States. The consequences, they will be quite dire. I expect very, very bad things to come from these policy choices. And I'm a little bit afraid that more people do not recognize and speak out about it in the current moment. As I said in a prior video on this channel, you get 1 year. I always give you 1 year to do whatever you want without any evidence. But when you get to year 2 and you start to institute ridiculous policies based on no evidence, I'm going to call you out on it. And that's why Stanford, with your testing of vaccinated, asymptomatic, and masked individuals, is getting my scorn on Twitter. And that's why places that institute mandates for very, very young children, even though those are against the WHO guidelines and kind of against basic common sense, and also not supported by any prospective randomized evidence, they're going to get my scorn too. And I worry a little bit that even though this man that many of us, myself included, didn't like, even though he's gone, we still live in his shadow and he still dictates our policies even long after he's gone. We have to do better than having policies that are merely meant to thwart someone who is not there. The boogeyman is gone. It's time to get back to evidence.